Hello, colleagues. I'm here talking about the criteria for treatment of hepatitis, particularly chronic hepatitis B. Now, this is a very common question when patients who have a diagnosis of this condition seek to get some treatment in order to eradicate this from their body. To many, it sounds like hepatitis is like some malaria or some parasite that has to be taken out of the body once it's been diagnosed. They are surprised when they do not get the idea that they were due for treatment. And so it's quite confusing. But there are set criteria that are in place to ensure that the appropriate management is given to patients who really need it. And this is not about ensuring that there are resources around, but it's about the rationale and the science behind the treatment. There are three ways and mechanisms by which this is decided. If a patient with chronic hepatitis B has evidence of decompensated cirrhosis, decompensation means there are complications, meaning that there are things like swollen abdomen, or maybe they're getting a bit of swollen legs, a bit of yellowish discoloration of the eyes known as jaundice, or maybe losing weight, and there has been a detected level of hepatitis B virus in the blood, whether or not this is beyond the threshold, that is about 20,000 units per mil, they are recommended for treatment. There is no need for liver biopsy for these patients. If the patients are too sick and too unwell, then, and if there are resources available, liver transplant can be offered to them. The second scenario would be for those who have cirrhosis, but they are yet to decompensate, meaning that they are going around with no evidence of any concerns imminently of a threat to their life. For this category, doing HBV DNA will be relevant, which is the viral load of greater than 20,000 units per mil. If the ALT is normal, ALT is the liver enzyme that suggests ongoing damage. If that is normal and the viral load is above 20,000 units, that is important that they will be treated. If the DNA level is detected, and even if it's not within the threshold of 20,000, they will still need to be treated once there is elevation of the enzyme ALT. Now, in many instances and in many developing countries, whether or not there is the threshold of 20,000 of the viral load is detected or not, it will still be relevant to go ahead and give them treatment, as a diagnosis of the cirrhosis alone can actually mean that there has been an ongoing damage due to the hepatitis B. And so treatment is given, and they may need a liver biopsy or some other non-invasive liver stiffness measurements, such as the APRI score or the FIB-4 score. The third category is if there is a severe reactivation of chronic hepatitis B, or those who do not have cirrhosis yet, but their hepatitis B viral DNA, viral load is above 20,000 units per mil. You start treatment. So, in a nutshell, the criteria for treatment for hepatitis B is robust and clearly understood by clinicians and those who care for the liver. That's it for now. I'll wait to welcome you in the next course so that we can get better education about how to stay safe with hepatitis B. Thank you.